Hi, nice to finally meet
Hi,
you.
I'm Joe.
How's your week been like?
My week's been great. Just been studying, excited to graduate. I've had two clinicals this semester, so I've been really busy with that.
Yeah, seem very busy. Anyway, my name is Dan Saban, and I am a student at Northern Illinois University, and I am majoring in physical therapy. I'm currently enrolled in AHRS 493, which is counseling and rehabilitation services, and this class pretty much teaches me how to improve my counseling and communication skills. And the assignment I'm doing now is going to help me practice my skills.
Okay.
We discussed this on the phone, but just a reminder that this interview will be recorded and will be viewed by my instructor and my peers.
Okay.
And then they will give me feedback. Is this okay with you?
Yeah, that's all right.
Okay. Also, this video and information is being shared today will be confidential, but there's a small exception to that. If you discuss anything that'll hurt yourself or hurt other people, then I must report that to the authorities.
Okay.
And the purpose of this session is to gain experience in listening and responding to you as you share with me a current or past situation that you're dealing with. And do you have any questions for me?
Not at the moment, right now.
Okay. Okay, then let's get started. What would you like to talk about today?
All right. Today, I'd like to talk about my experiences in clinical. As a nursing student, I'm in my final semester where I do my critical care internship.
Okay.
So I deal with a lot of sick and critically injured patients, and we have to be realistic. We're not gonna save all the patients we get. Sometimes they're too sick to get recovered. So we try our best to give the best care as we can with the any means resources we have, but even if we give 100%, try to make it happen, and we can't, and that can be a little depressing.
Right.
Since this is my first time dealing with this type of situations, you're dealing with this like almost daily, seeing the patients go away, and seeing the patients' families, cry. Get really depressed over it, so that kind of makes you feel connected with them as well.
So how was that like for you when you experienced your first patient?
When I saw my patients pass away?
Yeah.
It was definitely hard, you kind of ask yourself, oh, what could I have done, or what could I have done with my, with the nurse I was with. You try not to feel guilty about it, because they know, even the family members know that you tried your best. Sometimes there's nothing you can do, and that's the way it is. You feel very frustrated.
And when do you feel frustrated? When do you feel like this?
I feel frustrated when I'm, reading over the study materials. You read about the conditions, and that kind of reminds you about the patients what kind of different types of patients you had. So you try to not think about it. For instance, I know this guy had heart problems, and I was reading about cardiovascular disorders, and it kind of flashback memories.
So as I hear you, it's really tough for you to experience this when you're working at a nursing place, right?
It can be, yeah. You try to be professional, since you do have to take care of other patients. Going back to that, being frustrated. It can be frustrating, since you ask yourself every day, what could I have done to make the situation better? And you read about this kind of conditions in your textbook, and that reminds you of the time when the patient's family members had to deal with the dying process. It's hard to not to remember those stuff, especially when you're working there. You go past by all these patient rooms, the conversations you had with the family members and the patients, so it can be a little depressing.
And during that situation, what thoughts were going through your head at the time?
it's hard to say since a lot of things were going through
This
my
happened
mind.
so fast, right?
Yeah, so you try to make sense of what just happened. Like the patient, like wow, I never, even with my family members, I fortunately none of my closest relatives passed away, so I can only imagine what the family members had to go through at the time, and try to kind of emphasize that with them.
Okay. So, what are you feeling as you are telling me all this?
It's you try to feel proud of yourself for what you did. Nurses, they understand that this is the reality. They thanked me for what I did to help them out.
Right.
But at the same time, since it could be just that I'm new to this whole process, I'm feeling guilty about it. You kind of try to put yourself in that spot. Like, what if it was my family?
Right.
So it's. I mean, I wouldn't say I'm happy about it that I did my job. I guess it gets better as time goes on.
Right.
I'll get used to this. So you just have to remind yourself that you did your best.
Yeah, absolutely. Yeah.
And then just give your credit. Sometimes, just don't be too harsh on yourself.
Okay. Yeah. All right. So today we pretty much talked about dealing with patients' death and their family members having to cope with dealing with the situation. And it looks like we're out of time right now. So hopefully I'll see you again and we can talk more about this another time.
All right.
All right. Thank you.
Thank you.